Hi everybody, this is Dr. Balterio. I watched my own video, which I do. I go and see if there's anything I left out from my videos, and I realized in my last video on blockages to healing, I had left out a few things, and I left out examples of cases. So I decided to make a new video to kind of, explain those and finish that off. So here we go. Just to jog your memory, blockages to healing, or focuses, plural foci, it's a concept that it's a pretty vague one, but it's a very useful one in medicine. A focus is anything that stops the body from healing itself. This is a very broad category. It can include teeth, it can include scars, infections, emotions. Almost anything can fall into this. Um, Naturopathic medicine generally is wonderfully effective, but when it's not, quite often one of these foci is responsible for it. There's something in there that's stopping the body from regulating and treating itself. My first video on this subject goes into this subject matter in great detail. So if you're curious a little bit more for me to flesh this out a little bit more, just go back to the previous video. So focuses. Once you know what a focus is, it's actually reasonably simple to treat it. The trouble is figuring out where a focus is. Um, Before we were just kind of guessing or going by existing signs and symptoms and history. In the 1990s and even up till recently, a man named Frank Barr, who's a medical doctor in Germany and who studied with Paul Noget, the originator of auricular acupuncture, came up with a system of diagnosis and therapy that is very, very effective. It lets us screen out foci, without a history, and it allows us very, very effective treatment and grading of foci, and I'll explain that in a minute. Um, it allows us to determine which foci are the most severe and observe how they respond to therapy, whether they respond to therapy, so that we can treat them very effectively and with a minimum amount of effort. Him and his students have discovered three layers of foci. There's the physical ones, which are the original ones we discussed, the dental, and the emotional, which are just a very recent discovery. In general, the interesting part about Barr's system is you don't need to treat every single focus a person has. If you, for instance, have a series of graded foci and then you treat the top one, you treat the most severe one, the vast majority of the time, the rest of them will respond as well. You might get a one focus going down a couple of points, but then but then the rest of them, or the top focus, will go down a couple of points, but so will the rest as well. This is wonderful. This means you can generally go from having dozens of treatments and quite a few ears or needles in the ear to having one. It's very effective. And with these three levels of foci, they are do themselves form a hierarchy. So emotional foci, if you treat an emotional focus, all the dental ones, no matter how severe, go down. If you treat a physical, or if you treat a dental focus, all the physical ones go down as well. So you can see by knowing this concept and using this particular system of diagnostics developed by Barr, we can actually be very, very effective and precise and efficient with our therapies. So diagnosis, there's two parts to it. Um, there is preliminary diagnosis. Now, there are a number of factors in the brain which can interfere with the test and make sure we don't get accurate results. What we're doing with this preliminary diagnostics, or with these preliminary diagnostics, is figuring out what exactly those factors may be if they're active and neutralizing them. So these factors are respectively oscillation, which is kind of switching back and forth between brain hemispheres very quickly, and not in a good way. It just means your body's not particularly neurologically stable. Usually there might be a very severe focus doing this, or it might be a sinus problem. So we'll treat it either way with a little bit of ear acupuncture. Inversion. Inversion is kind of where your body's getting its sympathetic and its parasympathetic nervous system or nervous inputs mixed up a little bit. So again, we fix that with ear acupuncture. Dominance and laterality are quite closely related. dominance is which half of the brain and hence which half of the body is dominant. Um, Laterality is simply how strong that dominance is expressed in the physical body. There, it seems like it would not be that difficult to determine this, but it quite often is. There's a number of people who have dominance and laterality disturbances, and this can, because Barr's diagnostic points are definitively on one side of the body versus the other, this can cause problems. Again, we use ear acupuncture to treat that. The interesting part about going through this preliminary diagnostic procedure is this in and of itself is quite therapeutic. Very often people will report a feeling of relaxation or sleeping or just deep inner peace that happens when they get to this point, when they go through this procedure. So we're not treating the deepest level of focuses with this, but the person usually gets quite a bit of benefit out of it. So just to review, I did this in the previous video as well. This is Barr's diagnostic system. So there are 6 categories of focuses, each of which has a particular substance associated with it, and each of which has a particular spot on the ear and on one particular side of the body uh, that indicates its presence. By bringing a vial of the substance to that spot and measuring the pulse in response to that, we can determine whether or not there's a focus there. And then by using the vial to locate another spot that kind of has that same arouses that same pulse response on the ear, we can determine where the focus is. So there are 6 categories of focus, probably more. There may eventually be more discovered, but these are the 6 we have now. 0 is the monoamide oxidase point. It is the most severe focus. 1 is the histamine point. It's quite bad as well, but not as bad as monoamine oxidase. 2 is the endoxin point. Again, it's less bad than 0 and 1, but worse than 3, 4, and 5, and so forth. The lower the number, the more severe the focus is, and the higher of a priority it becomes. Monoamine oxidase point is called 0 not because of any kind of numbering error or anything, but because 1 to 5 were discovered first, and then monoamine oxidase was discovered afterwards. And I've just heard that there may be another one, so I don't know what I'd call it then. Maybe I'd call it like the -1 point or something like that. But we'll go and take a look at that. But that will come as it clinically develops. So here we're going to give an so of treatment. This is just a random example. It's kind of a couple of combined of a couple of cases. So let's say we have body focuses here. We're evaluating for those. This person has a 0 level focus at the tonsils, and then they have a 4 level focus at the appendix. Say we do some treatment. We do some ear acupuncture on the tonsil point, and then we come back and reevaluate the person a week later. Now their tonsil point has gone down 1 point, and their appendix level, even though we didn't treat it, has gone down another, or has gone down a point as well. So that's what we see most of the time. So it means instead of treating every single focus a person has, because literally we can let's see, literally we could, let's say a person has 6 focuses in the emotional, the dental, and the physical layer. We don't need to treat 18 things. We can treat the 0 focus on the emotional level, and we can get all of the rest of them down. So that's kind of the implication of this, and this is a really brilliant implication. By using this 1 point and using it fairly consistently, we can, in a cost-effective and time-effective manner, improve a person's ability to heal their body just immensely. So next I'm going to present a case. This is kind of a case that's a composite of like a number of cases that I did, but it typically shows how this process occurs. So got a woman in her late 50s with menopausal symptoms. We did normal treatment, which for me is hormonal balancing and general drainage. She got better, not 100% better. So let's go and look. We did focal diagnosis on her. So this is her emotional level, and those are the like emotional level focuses usually are in a brain structure. We're not quite as clear what they mean. If we identify a particular spot as being a dental focus, we can say, yeah, it's this tooth. And if we can identify a spot, a body focus level as, a particular spot, we can say it's this part of the body. The emotional ones, we don't really know what they mean as much. We know they're usually brain structures, but not always. So um, we can still treat them, however. So that's the important part. But figuring out what they actually are, likely will be a longer term effort. So that may take several years. But so let's see. This is her emotional focuses. And these two are her dental and her body focuses. So treatment was auriculotherapy. And next week, there we go. She's moved from a zero. The left thalamus was, which is what we treated, went from a 0 to a 1. Excellent. Ah, look at that. So now we've got her dental focuses have the original, the highest one was tooth 4-8. Now a new one has moved in. This happens quite a bit. When you decrease, you will get new focuses popping up in when you treat focuses from categories of above, particularly in different categories of focuses. So that is why I tend to treat only the highest point until that our highest point, the highest point in the highest category of focuses, until that category of focuses is done, and then I will go to the next one. So yeah. So and then we've got new focuses popping up. So just to summarize this kind of composite case, we continued treatment until the emotional focuses were completely resolved. Then we treated the dental ones and finally the body ones. That person's hot flashes and menopausal symptoms gradually decrease. With focus therapy, you never really get like dramatic results, but you do get people becoming much more responsive and you do get slow improvements. So, what are the implications of this? We can shift stubborn illnesses with focus therapy. Sometimes, like most of the time, people do well with naturopathic medicine, but we can make even a good responding person's response much better with focal therapy. I also suspect, based on my experience with cancer patients, that treating focuses removes predispositions to future disease. Many cancer patients improve quite a bit when their focuses are treated, as do others with serious disease. I suspect, and this is just a suspicion, I don't have much data based on this. I'd have to be practicing on thousands of people for decades to really come up with good hard numbers. But I suspect that by treating these focuses in advance, there will be a decreased rate of these chronic diseases. Now, another implication, because of this hierarchical nature of the foci, emotional are higher than dental, which are higher than body, there may be other levels of foci that we don't know about right now. One of the ones is that I'm thinking about a lot now is miasmatic. Is miasmatic higher than emotional? Is it lower? I couldn't tell you. But is there a spirit level as well as emotional? I don't know at all. But I will continue to explore it as best I can, and you all, my patients, will continue to reap the benefits as much as we can. So now, because of these implications in this treatment, I or these implications in this thought process, I include focus treatment in almost all my treatment plans. It removes the responsiveness even in people who aren't seriously ill, and because it may, notice how I underline that may, not does, may, because we don't know yet, reduce the risk of subsequent diseases later in life. So low risk treatment, low cost, and so I think, why not? Anyway, that's pretty much all I have to say on this subject. I hope you enjoyed this little kind of addendum presentation. Um, Please feel free to contact me with your questions. That's my email address. That is my website below that, drpaulterrio.com. My number is 403-276-8800, and my address is 1302 Edmonton Trail Northeast in Calgary. I feel free any contact you would like to give me with, or any questions and comments you'd like to show, and I'll do my best to answer them to your satisfaction. Please do like and subscribe to my channel, and hope you have a great day. Take care of yourself. Bye.